many patients who have had teeth removed in the past but never replaced them with dental implants, you'll start to see bone loss, and it's an insidious process. It happens over time. What you'll start to see is the corners of the lips start to cave in, the chin becomes more prominent, it goes down and out, sort of like a witch chin, and you also see the creases in the face and lines around the mouth become much more prominent. And the reason this happens is because the bone is thinning, and there's not a structure there to put the face together, essentially. Your face becomes very thin and frail. And if you look at what a witch looks like, you start to see that kind of typical denture look. So what dental implants do is that they stimulate the bone so that you never have to have that happen, and you can also have your teeth back. The natural teeth stimulate bone formation because there's pressure that the root puts on the bone. When you look in your mouth, you see the crown, you see the teeth, but you don't see the root that's stabilized in the jawbone. So when the tooth is pulled, the bone begins to wither away, it melts away. The most happens in the first year. And what we do with dental implants is when we extract the tooth, I could actually place the implant directly into that socket in many cases, and in other cases we put replacement bone graft into that socket. And after that, you'll see that the bone doesn't wither away. And the implant will help stabilize the bone as well as replace the missing teeth. So it's really a win-win. And one problem is a lot of my patients, they're nervous. They haven't been to the dentist in years, and you're not alone. Another question I always get is, how much does it cost? I heard implants are expensive. Well, I'm here to say that the consult is totally free. We'll take your x-rays totally free, no charge to you. We'll take a look, I'll sit down and discuss your options. There's a lot of options with implants and it can get a little confusing. You may have heard other dentists say, well, your bone's not good enough. We're not able to do dental implants in the past. Well, the technology has really evolved. I've taken these courses. We're able to put dental implants in certain places that we didn't before, and we have different sizes of dental implants. So for people who have a lot of bone but it's very thin, we have very thin and longer implants. For patients who have very wide bone but it's very short, or there's a sinus or there's a nerve around that bone, we have very, very short implants that are wider. So it's much more accommodating now. There's really no patient that I've ever seen that wouldn't be a candidate in some form from dental implants. It's very rare, less than 1%. Another common question is it gonna work? Is my body gonna take it? Well, the success rate on dental implants is over 98%. So there is 1 or 2% that don't work out. That is true, and that's for just about any dentist who's placing enough dental implants. But 98% success rate. And then out of those 1 to 2% that don't work out, we come back in 3 months, we let it heal, and we replace the implant at no charge if it's within the first year. And usually, most of those patients, over 50%, it works out. So the real long-term success rate of dental implants is actually over 99%. And it's important to get the new technologies and take the new scans, take digital scans, plan out your implant before we even do it. Take a CBCT scan. Not all dentists have a 3D imaging software in their office. At my office we do. We have the best technology, and that's a commitment that I've always been to always embrace the latest technology because it is the best. And the more dental implants you do, the better you get at it. So a lot of dentists these days, they do dental implants, but the question remains, how many dental implants have you done? I've limited my office to oral surgery and implants for the past 7 years. I've done a lot of implants, and there were times where I was doing 10 to 20 implants per day. So I've seen just about a wide range of cases. I've seen pretty much everything. And there becomes this level of skill where you get to this point where you can do it faster, more precise, you can do it at a more affordable rate, and you could also do it just better than the person who's placing 1 or 2 implants a week. So if you do go to any dentist, if you go to me or you go to another dentist, make sure it's somebody who is placing a lot of dental implants, because it is a skill. And you could read all the books you want, but until you actually get in and do implants on real patients, it's these little tricks, little nuances that I know, or another dentist who does a lot of implants would know, that we could work around that. more difficult cases and make it work for you. Make it work within your budget and make it work for your health and for your happiness and for a dental implant that is going to last. And when my patients ask me, that's the other question is, how long is it going to last? I always tell my patients a dental implant is for life. That is the plan. Does that always happen? Like I mentioned, it's 1% it just doesn't take. It is a foreign body, but it is very biocompatible. So the titanium alloy that makes a dental implant is very biocompatible. It's very easy on the body. The body is very accepting. You take some antibiotics and some pain medication, and usually within a week or two, very minimal swelling or pain, usually a day or two, just a little bit of pressure. And generally this dental implant should be just as strong, if not stronger, than a natural tooth, because there's what's called osseointegration, where the bone actually forms around the dental implant and it becomes part of the jaw. So it's really one piece, and it really does replace the root of the tooth. It's not exactly the same, but it's the best alternative if you're missing a tooth. So the answer is 100 years plus, so for life.